Gainesville.
You're a Gainesville.
No, I don't disagree.
I got
But
it without.
if there are people
How are
that
they?
need
Good.
them,
I don't want them, but I
put a
did.
vape box
A little better.
around.
There was one game where we won it 31 years straight and we lost.
The first time.
First
I
time
don't
31
know
years.
what the second time was, but yeah,
Alejandro,
that's
same thing if I do it really bad, I hear it.
I think we're ready.
there are no more room.
Yeah,
Which one do you have?
he does.
Yes.
Thank you so much.
Alright. Hello everyone. Thank you for coming today. I'm really happy that you're all here. My name is Justin. I'm a pharmacy resident here at Sarasota Memorial Hospital. I just started a couple months ago. A little background about myself is that I went to the University of Florida for my undergraduate schooling as well as for pharmacy school. And now I'm here completing my PGY1 pharmacy residency, which is a one-year program here. So we're talking about penicillin allergies today. So some objectives I listed here for you all. This is what I want you to take away from this presentation, and what by that presentation we'll be able to describe the common types of drug allergies. We'll be able to distinguish between a drug allergy and a drug intolerance. So we'll talk about what the differences are between that. We'll organize what a penicillin allergy actually has on your health, or what kind of impact it has. And lastly, what the penicillin skin test is and when it can be useful. So, imagine you are a chemist in your laboratory. It is 1928 and you're in London. You're trying to work on growing some bacteria in a petri dish. You left it out on the counter overnight, but the next morning you realize the window was cracked open and it brought in some contamination from the outside. You look in your bacteria dish and there's no bacteria growing. You're very puzzled. So you take it under the microscope, you look into it, and it's actually, what you see there is a fungus called Penicillium. You later realize this is, you discovered the first antibiotic called penicillin. And this is what Alexander Fleming discovered in 1928. So this is a quote from him. He accidentally discovered it, basically. You can read that if you like. In 1945, he did win the Nobel Prize for discovering penicillin, and penicillin was one of the most effective antibiotics, especially in World War II. It was used very commonly. However, by the 1950s, something called resistance started to develop to this antibiotic, and by the late 1950s, this resistance was becoming a concern with penicillin. So now that we know a little bit about the background, let's jump into a question. So myth versus fact. I want to see where you guys are at right now. Are penicillin allergies the most common type of drug allergy?
Yeah.
By show of hands, how many of you think this is a fact? Alright, how many think this is a myth?
Don't know.
Don't know. Good answer as
Plain and
well.
simple.
So in fact, this is actually a fact. Some studies show that approximately 10% of the population at one point or other has reported a penicillin allergy. So it's very common allergy. And of drug allergies in general, this is the most common cause of drug allergy. So some more background. As I mentioned, about 10% of the population does report a penicillin allergy. But shockingly, 1 out of 10 of those people that do report a penicillin allergy are not really allergic to that penicillin. And the way we figured this out is through various tests, and also we challenged some allergies with the drug itself. So this is how we figure out if people are actually allergic to penicillin. So we may be wondering why so many people are not actually allergic to penicillin, because this are pretty shocking. So unverified penicillin allergy is a public health risk. What I mean by this is that because of a penicillin allergy, we as healthcare providers have to use alternative antibiotics when treating infections. So infections do occur, unfortunately, in some situations, and some patients do have to be admitted to the hospital to be treated. And if penicillin allergies are present, and if there are severe allergies, we oftentimes have to use alternative antibiotics. And some of these alternatives may not be the best antibiotic to choose from, just because the patient has that allergy to penicillin. So that's probably some of the reason why it's not the best scenario.
Justin.
Yes.
And also, like unverified penicillin. What's unverified penicillin?
Okay, so the question was, what is unverified penicillin and how does it differ from just a normal penicillin allergy. So what I mean by,
Oh, yeah.
okay, is that your question?
Yeah,
Okay.
yeah. It's the allergy that's not verified. That's all.
Yeah, so the allergy was reported by anyone to the healthcare provider, and unverified means that it was never challenged. So we never challenged to see if there was an actual reaction to that. It was just reported by a patient. So the last statistic I have here is that 80% of allergies to penicillin are actually lost after a period of 10 years. So what this means is that over time, allergies change, especially to penicillin. So after 20, 30, or 40 years, that allergy to penicillin you might have had as a child may not even be present anymore. So this is something that we can test for. We'll talk about a little later. All right, so I mentioned resistance just on the slide before. We're going to talk a little bit more about resistance and how this plays an important role in penicillin allergies. So you can see by this graph here, this is representing the number of new antibiotics that were developed over the past 30 to 40 years. You can see the rate of new antibiotics for each year range that they provide has been decreasing over time. So what I'm trying to show by this graph is that there's less and less new antibiotics every year. However, the rate of resistance to antibiotics is rising at the same time.
Why is that? Is because it's not profitable for the companies to
So the
work
question,
on them, or
the question was, why is this happening? Why is it not profitable for the companies? And that's definitely, it could be a reason why there's not any incentives for these drugs to be developed. So it does play a role into it as well. Trying to think what else it could be playing a role into that. A lot of times, yeah, because it does require a lot of money to develop these drugs, and there are some antibiotics out there already, so there's just not incentive.
Yeah,
That's probably
alternatives.
You are very
return
smart.
on investment. So that's a huge problem. We're having more resistance to antibiotics, which we'll talk about in a few more slides. We'll talk about why this actually happens and what is the mechanism behind resistance. So it's a growing health concern, basically. So in this slide, I actually explain what resistance is. So if you imagine a bacteria, they're really small organisms, microorganisms is what we call them, and they have DNA that is able to rapidly divide and rapidly adapt to their environment. And their environment sometimes includes antibiotics, which we use to eliminate them. So if you have these antibiotics, which we call stressors in their environment, some bacteria will actually change their DNA and develop defenses against these antibiotics, and they end up becoming resistant. That's what we call resistant. So they develop these defenses against antibiotics. And unfortunately, bacteria can share their DNA between other bacteria that are around them. So they can share these defenses with other bacteria, kind of giving them the tips to avoid our antibiotics. So a lot of common drug-resistant bacteria that you may have heard of, one of them might be called MRSA or MRSA. I don't know if you've heard of that, but that's an example of a drug-resistant organism. So the rate of resistance was rising, as I previously mentioned. So what is one of the reasons why this rate of resistance is rising? Does anyone have a good guess?
overuse.
Exactly. Overuse and taking too many antibiotics, that definitely plays a role into why resistance is occurring. This is a statistic by the Centers for Disease Control and Prevention. 269 million antibiotic prescriptions were dispensed from outpatient pharmacies in the year of 2015. So there are quite a few antibiotic prescriptions being utilized in the outpatient setting. And according to the CDC, approximately 30% of these were considered to be unnecessary. So what is one possible reason why they may be unnecessary? Does anyone have a good guess?
They're not treating bacteria that's there.
Yeah, exactly. They're not treating a bacterial infection.
They're treating a virus.
Yeah, exactly. A virus can also be a cause of infection. So antibiotics will not work against viruses, unfortunately. They only work specifically for bacteria, and bacteria and viruses are completely different. What's a common example of a viral illness?
Flu.
Flu is a good one. The common cold is also another one. And antibiotics will not be effective. Alright, so we're going to dive into the meat of the presentation now, penicillin allergies. Now that we understand some background about resistance and antibiotic overuse. So I have another myth versus fact for you. Penicillin allergies are passed down through family generations. How many of you think this is a myth? Okay, a couple, a few. How many of you think this is a fact? Alright, a couple, a few. So the answer is actually a myth. So every person can develop a unique immune response to individual substances they encounter, including drugs. And this is something that's not passed down through genes or family generations. One of the most common stories we do here in the hospital, so as pharmacists we do partake in interviewing patients about their allergies. We'll talk about your allergies and see what kind of reaction you have and what kind of therapy we may have to adjust. So one common story I often see is that people will say that they had a reaction as a child, or their parents told them as a child to avoid this certain medication, sometimes penicillin, and there was no memory of an event. It was just that their parents told them to avoid it because their parents had a reaction. And unfortunately, this is a concern because you may or may not actually be allergic to that, just based on what your parents had. So I want to take a little poll. How many of you have had a drug allergy before in general, or you know someone with a drug allergy? Yeah, so pretty much everyone is going to know someone who has a drug allergy themselves. How about if you know someone or you personally have a drug allergy to penicillin? So it's actually pretty common. And how many have undergone a penicillin skin test before? Either yourself or you know someone that has. Yeah, so this test is somewhat new. It's been growing over the past 10 years or so, I would say. And this test does help to determine if an unverified penicillin allergy is true or can be removed from an allergy record. Alright, so the importance of penicillin allergies. Let's imagine your mother or grandmother, we'll call her Judy, unfortunately developed an infection that required her to be in the hospital. She had a penicillin allergy of hives as a child, and because of that, here in the hospital, we had to avoid a certain medication that was the best antibiotic to treat her infection. So instead, we had to use an alternative that was a little bit less effective. Judy ended up having good recovery, but the antibiotic that we used may not have been the best one. And the reason that occurred because she had a penicillin allergy. So that's just one example where penicillin allergies limits the choice of antibiotic therapy. It prevents us from using the best antibiotic in some cases. Not all cases, it's just one example. The alternatives often are more expensive, they have more side effects, and they're often what we call broader spectrum. So what I mean by that is every antibiotic is a little different. They all have certain mechanisms and ways they target bacteria. And for broad spectrum antibiotics, that's an analogy to, let's say, shining a flashlight versus shining a laser pointer. With the flashlight, you have a very broad, the light rays expand out. The laser pointer, they're focused and narrow. So that's similar to a narrow spectrum antibiotic versus a broad spectrum antibiotic. And the problem with broad spectrum antibiotics is that they promote resistance. So what happens is that they target some of the good bacteria and some of the bad bacteria that our bodies normally have, and they cause those bacteria to develop those defense mechanisms against the antibiotic. So overuse of broad spectrum antibiotics is a key part of what we do as pharmacists and what physicians and other healthcare providers work on. It's something to be called antimicrobial stewardship. So this is the stewardship of the antibiotics to lessen resistance and improve healthcare outcomes. And lastly, some studies have shown that unverified penicillin allergies do result in longer hospital stays, and as I said, increased drug resistance. Alright, myth versus fact. You can see a trend here. A drug allergy includes reactions such as upset stomach and diarrhea. How many think this is a myth?
No, not a myth. It's
Okay.
true. It's true.
Couple for a myth. How many think this is a fact? Alright, about half and half. So the answer to this is actually a myth. This is a common misconception about drug allergies and drug side effects. So these are all listed here are drug side effects. How many of you knew that prior to this?
I think that has to be by individuals. You know, it affects me if I don't have anything in my stomach, and I take a drug.
Yeah, so that's that. Yeah, the statement was it does affect you.
Yeah, but maybe some other people, so that it's a mix, to mix reality.
Yeah, drugs do affect everyone a little differently, but it comes down to what is the mechanism behind the side effect or drug intolerance. So if it's related to your immune system, that's considered an allergy. If it doesn't involve the immune system, it's considered a side effect. And that's a key distinction that we have to make because allergies tend to affect drugs that are similar to, for example, penicillin. There's many antibiotics that are similar to penicillin, and if it's an allergy-related mechanism, sometimes there's sort of some cross-reactivity that we have to consider. But with the side effect, we'll get into a little bit, but it's something that's not related to the immune system. But it does affect everyone a little differently. That's correct. So as you can see here, allergy is the abnormal reaction of your immune system. A side effect is a known adverse effect of a medication. These are some common examples listed there. Some examples of allergy include hives, difficulty breathing, itching and rash, and side effects include upset stomach, vomiting, and diarrhea, just symptoms like those. Looking a little bit further into drug side effects, we equate this with drug intolerance. It's not really an allergy, and here's some more examples. The timing of onset generally is not certain. It can be shortly thereafter taking the antibiotic or drug, or it could be a longer reaction. But these are not considered immune-mediated reactions. And you can see here by my little diagram is that allergies are actually part of drug intolerance or side effects, but all drug intolerances are not allergies. That's an important distinction to make. So going a little further into antibiotic allergies themselves, there's a couple. There's actually more, like 5 or 6 different types of drug allergies, but I broke it down to the 2 major types that I wanted to let you all know about today. So the type 1, or we call them IgE, what that means is it's a specific type of antibody that our body produces that helps fight off foreign substances or invaders in our body. And sometimes our body doesn't know what is an invader and what is a drug. So that's kind of the mechanism behind drug allergies. Your body does not know how to deal with that drug and ends up mounting an attack against it. So these are considered your immediate type reactions, and then you have your non-IgE mediated reactions. So these ones they use a different antibody. They don't result in this immediate response. The most common example of a non-IgE or a delayed response is itching and rash. We see that very frequently here after interviewing patients about their allergies. And these are generally greater than 72 hours, generally a few days after that reaction, after the drug is taken. And some examples of the immediate type reactions, this include hives, welts, swelling. So hives is basically a swelling and redness that occurs shortly thereafter taking an antibiotic or medication. And the swelling, trouble breathing, and wheezing, those are actually a little more concerning because it does impact your airway and how you're breathing. And other more severe forms of type 1 allergies are the anaphylaxis and angioedema. And what these are severe life-threatening reactions to the medication. However, they do not occur very frequently. They're extremely rare, but it is something that we're always watching out for. So, as a pharmacist, I wanted to bring in some science behind this to help you all understand what we're thinking in our heads as we're discussing antibiotics amongst ourselves. So penicillins, as you can see, fall into the major class of antibiotics called beta-lactams. Beta-lactams are this structure here. So I provided that for you just for a little visual effect. All these classes of antibiotics, cephalosporins and carbapenems, they share that same structure. And on each one of these antibiotics, there's more side chains that pop off in various directions, but they all share that common core structure. And what we found over the years is that it's these side chains extending off the beta-lactam, that's what causes cross-reactivity and reaction to other types of beta-lactam antibiotics. I'll get into a little bit how often this does occur, but here's just some common examples of penicillins that you may have seen or heard about previously. One of the most common cephalosporins we have is called Keflex or cephalexin. And these are antibiotics that we often use in the hospital here for more severe infections on the right. Alright, myth versus fact. If I have a penicillin allergy, I can never take a cephalosporin antibiotic. How many do you think is in
Maybe,
fact?
maybe not. Maybe.
Maybe. So this one, we mentioned previously, cephalosporin is a type of beta-lactam, so it does share that core structure. However, there are different side chains. This is actually a myth. So we'll get into a little bit, but the rate of cross-reactivity to cephalosporin type antibiotics is very low, closer to 1% of the time. So cross-reactivity, this is a term that we use to describe the probability that having an allergy to one drug can cross over to another drug. So we mentioned that these share the same core structure. Here's an example of a common penicillin type antibiotic and a cephalosporin type antibiotic. You can see that beta-lactam structure there is shared between both molecules, but the side chains, these parts that are on the outside of the drugs, look a little different. So it's these side chains that determine how likely it is for a reaction to occur. And there's many different types of beta-lactam antibiotics. As of 2017, how many beta-lactam antibiotics do you think the FDA has currently approved? 10, 15, 20? There's actually 34 different beta-lactam antibiotics as of 2017. So there's quite a bit out there. And the biggest concern that we have, do you have a question?
Just a comment. He experienced this because he has penicillin allergy. Well, now I'll be really early, but anyway. When he got a prescription for this Keflex, it put that as a possible side effect or reaction. So he was afraid to take it. It said specifically, if you have a penicillin allergy, you may have a reaction to this.
Yeah.
Was that just too much information? Or, I mean, he literally said, I'm not taking it. I could have another reaction.
Yeah, so the statement was that there was a...
We wondered why that happened.
Yeah, there was an alert.
It's not an penicillin.
I reacted to Keflex also,
Okay.
so now I'm afraid to take anything. I'm confused.
Yeah, but, well, he literally didn't take it because of that. Fortunately, he got over. He's one of these people that they tell me I should worry. I'm going to worry about it, so he wouldn't take it.
So yeah, the statement was there was an alert that mentioned that there's some cross-reactivity to Keflex.
Sometimes maybe they give too much information.
It depends. With Keflex, there is a small chance of it cross-reacting. And what we'll do as healthcare providers, we'll determine what kind of allergy you had to the penicillin allergy, and that will kind of determine whether or not we want to give you this type of antibiotic. So if it's a minor allergy, we generally will give you the cephalosporin antibiotic, but if it's a severe allergy, we generally don't want to take that risk on you. So that's part of the methods that we go through.
We didn't get a lot of that information from his pharmacist. He just said, well, just take it when we call. So,
They print with whatever you get a printout when they give you the and they cover themselves to the nth degree, and then you're scared because it says, if you do this now, it will react with this, it will react with that.
Yeah.
And sometimes the doctors prescribe something and they are not aware that...
Well, I always consider the pharmacist the first line of defense on that, because I'm one of these people that think you know more about the drugs than the doctors do. They may know what needs to be done, but you know what'll make it work.
Yeah, we're the last line of defense before that drug reaches.
I consider you the first line of defense.
Last line and first line both.
Yeah, I mean, you're the one really who knows the drug.
Yeah, we're definitely the ones that know the drug.
And that's nothing against the physician. His is a different realm than yours. So when the pharmacist said that it may, or the paper said it may give you a reaction, right away he said, I'm not taking it.
That's definitely something to talk with your pharmacist about, and as well as your healthcare provider. So we can have a discussion between the pharmacist and the doctor to see if the benefits do outweigh the risks. And I noticed you had a question as
Is
well.
a rash? I had an all-over body rash after I finished the whole series of tablets. Is that considered severe? I didn't have breathing issues.
Okay. I mean, it would depend how your doctor interpret that, basically. Was it just, because a lot of times if it's just itching and rash, we don't consider that a life-threatening reaction, but it is something that we want to avoid because it's very comfortable.
Don't want it again.
We don't want to challenge you with that again
Yeah.
if we can. So that'll be something to definitely talk to your doctor about. Make sure your allergies are documented correctly. Any other questions at this time?
That test for the I'm sorry.
This lady is very smart.
Everyone's
Because
I just have a ton of questions.
Yeah. No, I that's what happens with me. I ask questions like crazy. But the pharmacist knows all that's related to pharmacy, all the drugs. The doctors, they specialize in lungs. He specializes in shoulders. He specializes in and they know the drugs there, but they are not aware of everything. But the pharmacy have to know everything that comes out. You guys are great.
Yeah, we try to communicate as well as we can with healthcare providers to ensure that we're being transparent, talking to every party involved.
The test, where do we get that? How do we get that?
Yeah, we'll get to that next. So,
Well, and does the test, is it specific for penicillin, or is there something out there for all the Sillins drugs that would?
so right now, the penicillin skin test does help determine if you have an allergy to penicillin specifically,
Okay.
but it is used for all penicillin type allergies.
Okay.
All right, moving on. What do you do in the event of a drug allergy? I just want to briefly touch on this, just to ensure that we're giving the right information to people. So with severe reactions, it's usually a medical emergency that needs to be, let's go to the emergency department and call 911. So some of those severe reactions I mentioned include anaphylaxis and difficulty breathing. While these are very rare reactions, it is something to be aware of. We're not expecting it to occur to anyone, but there's a chance of that happening, very small. And those minor reactions, definitely like itching and rash. I know it may be minor or maybe severe, but it's definitely something to talk to your doctor about, and they'll help better determine if that reaction should ever be challenged in the future, and if it really is an allergic reaction. After the event, make sure that all pharmacists and all of your healthcare providers know that you have an allergy, and importantly, make sure you know what drug name it was that caused the reaction, because we need to know exactly what drug it was and what type of antibiotic it was specifically, so we can best treat you in the future. So, the penicillin skin test. This is one of the most reliable forms of verifying an unverified penicillin allergy. 98% of those that undergo the penicillin skin test, therefore remove their allergy after the test. So that means 98 out of 100 people that undergo the test walk away with no penicillin allergy. What this test is, it's used for in those immediate type allergies. What this means, as we mentioned, the IgE type 1 allergies, those are those immediate types. And the reason why we have to use that is because the test is only completed over a couple hours, and we need to know right away whether or not we have any sort of reaction to it. So, and the test requires approximately an hour, and nurses, pharmacists, and physicians are often involved in the process.
Do they do that, for example, if you're in the hospital and need to be treated and penicillin is likely that it's going to work the best, but you have told me that would they just do that and try to use it, if that comes out okay, try to use a penicillin then in the hospital, or is this something you need to know before you might ever end up in the hospital?
There's a couple of different ways to get the penicillin skin test. We'll talk about that at the next slide. Oh yeah, sorry, the question was, can you undergo the penicillin skin test in the hospital if it results in a better antibiotic being chosen, or is it something that needs to be done?
I'm just thinking if they would automatically do it, if whatever you had, they found the best antibiotic would be penicillin, but you had a stated allergy. Would they then say, okay, well, we'll make sure that this is an allergy and see if we can give them penicillin right then and there, automatically?
Yeah, that is correct. We do offer it here at Sarasota Memorial Hospital, so we will, only when the results of the penicillin skin test will result in a better choice of antibiotic therapy. So that you're definitely correct in that statement. So the test itself, you can see here by the image, it's a little, we draw on your arm to make sure we're marking what we're doing. And what we're doing is instilling a little bit of this drug, and it's related to penicillin. One of the components of it is actually the drug itself, and the second component is a breakdown product that our body produces that has been determined to be the cause of allergy. So we're making sure that this is the right substance that is causing the allergy in the first place. And what we do is we scratch on the skin, we observe, make sure there's no reaction. Next step, we go a little deeper in the skin, observe, make sure there's no reaction. And lastly, we do a by-mouth amoxicillin test and observe for a period of about an hour to make sure there's no reaction. And this way, it's a sequential stepping system to make sure that there's no reaction, there's no severe reactions that can harm you, basically. The last step is removing the penicillin allergy. So, let's see here. So one option for getting a penicillin skin test is actually here in Sarasota. Dr. Wyndham at Wyndham Allergy, he does offer the penicillin skin test. So that's one resource you can utilize. And also, as I mentioned, here at Sarasota Memorial Hospital, we do conduct the penicillin skin test only for instances where the result of the test will result in better antibiotic therapy. So we don't offer for anyone that wants it here, unfortunately, but we have to kind of reserve it for those special situations. So I am no longer allergic to penicillin. That's something that you can say after the results of a penicillin skin test. We want to make sure that anyone that undergoes a test and has a negative result ensures that they never end up accidentally telling someone that they have a penicillin skin allergy or penicillin allergy, because many times you've had this penicillin allergy your whole life, and then all of a sudden we're telling you you no longer have it. So it can be easy to forget, and sometimes just accidentally slips out. So just make sure that after the test that all healthcare providers and pharmacies know that you no longer have an allergy to penicillin, because as we mentioned previously, having a penicillin allergy often results in using those alternative antibiotics. We want to avoid that if we know for a fact that you no longer have an allergy. Like reducing costs and reducing adverse effects. So one of the we call them collateral damage to antibiotics. What this means is that using too many of those broad spectrum antibiotics for a long period of time can result in a severe form of diarrhea that's infectious. It's called Clostridioides difficile diarrhea, also known as C. diff for short. So this is a rare event, but it is severe and it is a result of overuse of antibiotics. We're not expecting that to occur in many people, but it is something that we do see in the hospital. And as I mentioned, reducing antibiotic resistance. So what are the steps that I want you all to take today to become more active in your healthcare? First thing is ask lots of questions. What is the antibiotic being used for? What kind of infection do I have? How long do I have to take it? What kind of side effects are expected? So these are just some of the questions that I want you all to consider if you or a family member ends up having an antibiotic to treat an infection. Importantly, take the antibiotics as prescribed. A very common situation is that you'll pick up an antibiotic from the pharmacy, end up taking it, and then you don't take the entire amount of the antibiotic because symptoms improve, you no longer have any pain or other symptoms from the infection. So what happens here is that you end up having leftover antibiotics and you save them for later. Unfortunately, this ends up promoting some sort of resistance to the bacteria themselves, because if you don't complete the entire course of therapy, the antibiotics are not able to work the best as they could. And they end up leaving some bacteria out there that are still remaining, and they, as I mentioned, they kind of share the DNA, they grow and multiply. So that's part of the reason why we need to make sure that all antibiotics are taken as prescribed for the full course of therapy. The CDC recommends everyone become vaccinated and maintain clean hand hygiene as well. So the flu vaccine every year if you're eligible, which is most people, and also the pneumonia vaccine after age 65. There's actually a 2-dose series, and after age 65 it is recommended to become vaccinated. Takeaway points. I want you all to make sure that all healthcare providers are aware of your allergies. And we talked about how penicillin allergies include a variety of reactions. Those type 1, immediate type reactions, and delayed reactions. Cross-reactivity is possible, but it is generally rare. It's something that we as healthcare providers are aware of, and I want you all to be aware of that as well. And lastly, the penicillin skin test is the most reliable method for ruling out penicillin allergy and is used in certain circumstances. here are my references, and I'd like to open up for any additional questions at this time.
Under the penicillin line there, you had